Today we are going to talk about the role of antidiuretic hormone ADH, which is secreted from the posterior pituitary gland, also known as arginine vasopressin, and we will discuss its role in renal reabsorption. We are discussing the urine formation. We have discussed that during urine formation there is filtration of fluid in the glomerulus, and then the fluid moves in the renal tubule, and then there is reabsorption. We have discussed a lot of hormones and a lot of factors which affect the reabsorption of fluid from these tubules. And today we will discuss the role of ADH, antidiuretic hormone, in the reabsorption process and its role in dehydration and the conditions in which there is less fluid in the body. So antidiuretic hormone is secreted from the posterior pituitary gland, and it comes and it acts on the distal tubules, collecting tubules and collecting ducts. And when it acts on these tubules, inside these cells on the luminal on the basal side of the cells, this is a cell of a distal tubule or collecting duct or collecting tubule or collecting duct, and on this cell we have this luminal side. This is the luminal side, or this is the lumen. So we have this lumen, and then we have this basolateral membrane. So on the basolateral membrane, the AVP, the arginine vasopressin, it binds to the V2 receptor. It binds to the V2 receptor, which is the vasopressin receptor. Then the vasopressin receptor, the V2 receptor, is coupled with G stimulatory protein. It stimulates the G when it binds, when this ADH or AVP or the arginine vasopressin, it binds to V2 receptor. This receptor activates G protein, stimulatory G protein, which in turn activate adenylate cyclase, and that adenylate cyclase converts ATP into cyclic AMP, or it helps in the formation of cyclic AMP. Cyclic AMP then causes activation of protein kinase A. Protein kinase A leads to phosphorylation of proteins, and that phosphorylation of proteins leads to formation of aqua2 receptors or water channel formation. The aquaporin 2 channels, water channels or receptors, then they move to the luminal sides. Then they move to the luminal side. They get attached here. They get attached to here, and the water in the lumen, water present in this lumen, it starts moving from this lumen into the cell, and then from the cell through the aquaporin 3 and aquaporin 4, this water moves out of the cell into the interstitium, and that's how the water in the tubule, the water which was filtered here in the filtration process, which is in the tubule, is reabsorbed in the distal tubule, collecting tubule and collecting duct with the help of antidiuretic hormone. Now whenever there is increased release of antidiuretic hormone, the water reabsorption is increased. So all the conditions which leads to dehydration, in which the amount of fluid in the body is decreased, and it is important to conserve water, these conditions leads to release of a lot of ADH, and ADH or the AVP, it comes into action. It binds to its receptors, and then it leads to, through this pathway, it leads to a reabsorption of water. When the amount of fluid in the body, or the amount of water that is reabsorbed in the body, is sufficient enough or becomes normal, then AVP or the ADH is not released anymore, and then this hormone detaches. It detaches from this receptor, and further reabsorption of water is stopped. Then this water can move out of the body in the form of a dilute urine. So that's how the antidiuretic hormone acts to reabsorb water, and that's how it functions to conserve water during dehydration. There are a lot of other conditions in which there may be no release of antidiuretic hormone, which may lead to diabetes insipidus, a process in which a lot of urine, dilute urine, is passed because the person having diabetes insipidus is unable to reabsorb water in the nephrons, so he passes a lot of urine. Similarly, if a lot of ADH is secreted, then it may lead to a lot of conservation of water, and that condition is known as syndrome of inappropriate ADH secretion. So this is all about ADH and its role in reabsorption of water. Thanks a lot for watching the video.